Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about trigger point injections. A trigger point is a tender and painful area of muscle. It's a hyper-irritable spot in the muscle associated with palpable nodules in taut bands of muscle fibers. It can manifest itself as a tension headache, tinnitus, which is ringing in the ears, TMJ pain, decreased range of motion in one's legs, or low back pain. Usually palpation of the trigger point elicits pain directly over the affected area, and it can also cause radiation of pain into adjacent areas. So it's an outpatient injection given into the trigger point. It may be dry needling, which is where no medication is administered, or numbing medicine along with some steroid might be administered. It doesn't need image guidance. It really is a subcutaneous type injection. And as you can see here, the needle doesn't go very deep. I mean, here's the skin, and you're into these taut bands of muscle fibers where the trigger point is. The injection can help with myofascial pain, which is chronic pain in muscle tissue, fibromyalgia, tension headaches, tinnitus, TMJ pain, and low back spasms. You can see on this diagram that there are lots of areas that are amenable to trigger points, okay? All over the back, neck, shoulder areas. The procedure is an outpatient procedure. It just takes a few minutes. There's no image guidance necessary. The needle is placed directly into the area of tightness, okay? Usually the doctor will see a small twitch and feel it as well. As mentioned, it may be that they put the needle in and don't do any medication. That's called dry needling. The needle in and of itself may relieve pain, and it can be moved around in the area of the trigger point. And this can be repeated every few weeks. Well, what are the results? The results are often excellent for relieving the pain due to the trigger point or the symptoms. It can be repeated every few weeks. There's no large-scale studies looking at trigger points. The great news is they're often effective with no medication, and it's a very low-risk procedure with a very high benefit. Minimal risk, the needle's not put very deep at all. The biggest risk is that it may not work. There's a very slight risk of infection or an allergic reaction. If trigger point injections are used too often with steroid, it can absorb some fat and leave a skin indentation. The top pain management in Texas is through the Texas Pain Network. There are several affiliated clinics throughout Texas accepting over 50 insurances and providing over 25 treatment options. The board-certified award-winning doctors offer over a 90% average success rates. Visit us online at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.